Hello everyone, I'm Dr. Vivek Vardhan Veerapaneni, consultant pulmonologist at Shwasa Hospital, Narayanaguda, Hyderabad. This video is all about vaccination. Vaccination, I think it's the most heard word in the last 1 year. COVID vaccine is what most of you know about. There are many vaccines in this COVID, like Covishield, Covaxin, and Sputnik, Pfizer, etc. Apart from COVID vaccines, there are vaccines that are important for our lungs, to protect our lungs. This COVID vaccine is being given to prevent pneumonias or other dangers that can occur because of this COVID. Whereas vaccination for influenza virus, pneumococci are also very important, and also pertussis. These vaccines are also available, and pneumococcal vaccination is to prevent bacterial pneumonias. There are types of pneumococcal vaccines. It can be a vaccine that can be given for children, or there is a vaccine that can be given for adults. Depending on your requirement, these vaccinations will be given. The vaccine that is given for children is almost mandatory. It's in the part of universal immunization program in India. Whereas adult vaccination is somehow missing. Adult vaccination is what I would like to focus in this video, because there are many programs for vaccination of children, and everybody knows that. So there's a lot of focus on that, because vaccines sometimes people think is only for children. Unfortunately, it's not true. Vaccines can be given for adults also. Adult vaccination is something that is very highly neglected in our country. There's no separate program for this, and it is not given much importance because they usually feel that they're very healthy and they don't need any more dose to protect themselves from any other bacteria or viruses. That is a general perception of a public. Even we doctors felt so like before we knew a lot about vaccination. So a vaccination against influenza virus is very important when you are more than 50 years or at least 60 years. Or if you are even younger but having diseases like allergies, asthma, COPD, or any other comorbidities like diabetes, heart disease, kidney disease, liver disease, or suffering with any cancers, or had an organ transplantation before. So you are a candidate for vaccination, because this vaccine will prevent you from developing severe form of infection because of such viruses. Example is swine flu. So this vaccine will cover H1N1. Usually there are many types of vaccines available in the market, influenza vaccines. So consult your doctor, a pulmonologist or an allergist or a physician to know what is the right one for you and get a shot. So in the US they call it flu shot. They take it every year and it's like taken by most of the people. But somehow in our country the awareness is quite less about this vaccine. So I would like to focus or spot the importance of this vaccination, and I urge you all to get vaccinated if you're suffering with any of those diseases, or even if you're healthy. If you're more than 50 or 60 years, go get a vaccine shot done. Ideally, influenza vaccine is done once in a year. This is because of the nature of the virus that changes its character. Depending on that, this vaccine is designed every year by the World Health Organization, WHO. So it's always beneficial to take a vaccine. Usually the side effects are quite minimal. We give a lot of vaccines to our patients, and most common side effects that we experience, that we see that they experience are just pain at the vaccine site area. Sometimes they can have a slight mild fever, which can be quite well controlled. And that's it, nothing more than this. Some people very rarely may develop some kind of rash. Beyond that, we have not seen any side effects. However, post-vaccination, we make our patient wait for 15 minutes so that health is in a good condition, and then send them. Apart from this influenza vaccination, a pneumococcal vaccine is a vaccine that's given to adults. There are two types again. So both can be given to adults depending on their prior health conditions. The risk factors that I've spoken about for the influenza vaccination are the same risk factors applicable here too. So anybody can take this vaccine if you have all those diseases. But if you are healthy at more than 50 or 60 years, then you can just go ahead and take it. It's almost like once in 5 to 10 years. So it's not a big thing, but it may prevent you from developing severe infections. So coming into 5 minutes of this talk already, I would like to focus on one more thing. Vaccination is important because it prevents complications of a particular disease. I'm not saying that it will prevent an infection. You would have understood by now. We have taken so many COVID vaccines, so many of you. But still, one of your friend or maybe you would have got COVID in spite of taking the vaccine. But the severity is quite less. First of all, the acquiring the infection is itself less. But even if you develop an infection, the severity is quite less and you may not develop a severe disease. Similarly, influenza vaccinations, pneumococcal vaccinations, and other vaccines like pertussis vaccine, and there are many other different types of adult vaccines that have their roles in not just respiratory area but in different areas of the body. They're all very important. So adult vaccination is something that is missing. That is the area that I would like to focus and explain you about. So in this video, we are mainly focusing on influenza and pneumococcal vaccine. So vaccine will not prevent infections, but it may prevent severe diseases. So if you take two people who are diabetics and more than 60, one person is vaccinated and the other is not. Chances of this person who is not vaccinated to get a severe disease are higher than a person who is already vaccinated. So this is one simple example. You can keep on giving such examples. But I think you would have got the crux of this, that vaccination is important, it's safe. So I urge all of you who are eligible to go get your vaccine shot, and that way you can keep your health under your control. Thank you.